So recently there have been concerns that executions by lethal injection, which are supposed to be quick and painless, aren't either. Typically, executions are done with 3 drugs given in stages. So the first drug is an anesthetic, and it's supposed to anesthetize the inmate. The second drug is called a paralytic, and it's supposed to keep the inmate from flailing around. And then the third drug is supposed to stop the heart. Executioners used to use a drug called sodium thiopental as that first drug, as the anesthetic, but then the only company that made it in the United States stopped making it. So they went to Europe and said, can we get it from you? But European drug companies said, no, we are not going to sell it to you if it's going to be used for the purpose of executing inmates. So since they haven't been able to use the sodium thiopental for the executions, they've gone to another anesthetic. This one is called midazolam, and in 3 executions, there might have been some problems with it. Instead of going quickly and painlessly, witnesses who watched the execution said that inmates were gasping or snorting or making choking sounds, and at least in one execution that the inmate was actually speaking. So among states that do the death penalty, there's been some consideration, does this 3-step method really work? So now using this new drug combination has raised some questions about whether it constitutes cruel and unusual punishment and whether it might be unconstitutional. But in June of 2015, the U.S. Supreme Court upheld the use of midazolam for lethal injection in executions. The court said that the prisoners challenging its use didn't establish that a massive dose of midazolam entailed a substantial risk of severe pain. The court also said the prisoners failed to identify a known and available alternative method of execution that entailed a lesser risk of pain.